Hello, viewer. It's a pleasure seeing you today in this particular platform. So thank you for joining us. My name is Violet Mbiti, and I'm the host of this particular show, which discusses cross-cutting issues affecting the African continent. So a little bit about me is that I'm a team leader at Violet Mbiti Foundation, and I also chair the working group on political feminism, women empowerment, and women representation in African democracy that brings together youth from all the regions of the African continent. So joining me today are leaders from various civil society organizations in Africa, and they are going to introduce themselves and tell us they will even share the current status of COVID-19 in their respective country and what their organizations are currently doing to curb the COVID-19 pandemic. So, over to you, Nelson. And before we start, if you have not yet subscribed to this platform, kindly go ahead and subscribe so that you can get more updates once we go live. So, over to you, Nelson. Kindly share with us about the situation as it is in South Sudan.
Okay. Thank you, Violet. Hi, everyone who is joining. My name is Nelson Kwaje. I'm a South Sudanese technologist and an activist. I work with an organization named Defy Head Now, and I've been doing this work for the last 3 years. Defy Head Now works on enhancing trust between communities, and work focuses on, with a focus on hate speech mitigation and mitigating misinformation and incitement to violence. With respect to COVID-19, currently as I speak, South Sudan has about 34 cases that have been.
Hear all of you.
Okay, that's good.
Very loud and clear.
Okay. So South Sudan has 34 cases that have been recorded so far, with kind of the largest growth have been witnessed yesterday, with about 28 cases reported. In general, the work that we're doing right now in South Sudan, I run a platform called 211 Check. It's a platform for fact-checking misinformation regarding COVID-19 in South Sudan. And so far, we have been doing a lot of awareness. We also share data, and we do fact-check a lot of information that is being shared on social media, especially information regarding false cures, information regarding misdirections, information regarding that might lead to panic in the population. Right now, we have a community of over 120 people who are part of the platform from different professions, and we work with them to fact check this information and create awareness in the community. And so far, we've been able to intervene in so many matters that were like aiming to mislead the public, and we were able to calm down the situation and counter this level of misinformation and at times incitement. I'll stop here. The website is 211check.org, and we are also on Twitter at 211check, 211check, and also on Facebook with the same name. And my handle is at Nelson Kwaje, as the name which is written on my name card here. I will allow Mohammed to, at this juncture, I'll allow Mohammed to Montasir to introduce his work and what he's doing currently with regard to COVID-19 in his country. Mohammed, you're welcome.
Mohammed has just said that he's you know, at the moment it is Ramadan, so he has gone to break the fast. So he has said he'll be back in 30 minutes so that to share with us about now his country. Sigo, could you kindly share with us the situation in Kenya with regards to COVID-19 and what your organization is currently doing? to curb this pandemic? Yeah, you can go ahead.
Sigo, can you hear us?
There's a problem with his mic. All right. As Sigo works on his mic, so Nelson, so you've said that in South Sudan, there are 33 cases, isn't it? 34. 34 cases. And are there any fatalities?
No, at the moment there are no fatalities. There are only cases that have been recorded. There are no fatalities, but also there is no information on the. Oh, sorry. I mean, as I'm speaking right now, information just streamed in. Today they confirmed one more case, so it's 35. But there are no fatalities. It's mostly the 35, and there are people also who are quarantined, who are being quarantined for observation. But the cases right now is 35, and until yesterday morning, the cases in South Sudan were we only had 6 cases. So the majority, the 28 additional cases were recorded yesterday, and then one more case was recorded today. That brings the number to 35. Just by way of background, South Sudan has a population of close to 11 million. A big chunk of the majority of them some live in Juba and the main capital, but also a lot of people are dispersed throughout the 10 states in South Sudan. And by way of also contextual understanding it right now in South Sudan, the healthcare system is not the most robust, owing to the fact that in part due to the conflict, but also in part due to so many other factors that can be blamed on lack of governance and lengthy civil wars and stuff like that. So the end result is that you have a healthcare system that is not very robust, and also connection between the different states is very difficult. So people are afraid that if the cases increase, the capacity of the healthcare system might not be able to withstand a larger outbreak.
Okay. All right. Sigo, can you hear us now? Yeah, seems like let me reach out to him. So, Nelson, I'd like to ask, what other initiatives have been started by CSOs now in South Sudan?
In general, there are so many initiatives that have been started by CSOs in South Sudan. Most notably, we have one called Wagif Corona, which means Stop Corona. It is being led by an initiative called Anataban, and it's also like a grassroots awareness initiative that aims at curbing this misinformation. On the other hand, we have so many other initiatives also that are currently being started. We have one called Voice Force. Basically, it's a group of young people who go around to create awareness using bicycles mounted with a speaker and a small battery, and they cover a good chunk of kilometers, between 15 to 25 kilometers every day, just reaching out to the community and giving them awareness and providing information.
Okay, all right. And how is the healthcare system like in Sudan?
So I mean, in South Sudan,
In
like
South
right
Sudan,
now,
yeah.
yeah. I don't have a lot of background on that, but I can probably like speak generally. So South Sudan has a main hospital in the capital, Juba. It's called the Juba Teaching Hospital. It's the largest hospital in the country. Um, so that is kind of the main hospital right now, and because of the COVID-19 scenario, we have seen that hospital being the main, the main kind of like referral hospital in the country, and it's being used on. But also there are so many, several other uh, uh, what do you call them, branch hospitals across the country that are also serving the population. In terms of kind of robustness of the healthcare system, I think like outside Juba, like very few large referral hospitals that can take a number of people or serious cases. So that makes it that makes people, especially in rural areas, very vulnerable. Majority of them end up being served by NGOs that like MSF, WHO, and Goal Ireland, like so many other organizations that focus on health, with also private clinics and government hospitals. But like there is a good chunk of the healthcare system that is also being supported by NGOs and UN agencies.
Okay. The other question I have for you is like maybe you see, like here in Kenya, you find that they recently started the Wheels for Life that is utilized now so pregnant women now can access free transport now to go to the various health facilities at this particular time of COVID-19. I just wanted to follow up with you. In your country, are there such initiatives, or what outstanding initiatives have CSOs done?
Like my work is mostly to do with information sharing, so I might not have a lot of. I work in the area of technology and information sharing, so I might not have a lot of info related to healthcare and initiatives to do directly with health. Other colleagues who are part of the network, they focus on that. My work is mostly focusing on the youth engagement, awareness on COVID-19, understanding misinformation, understanding data, how data is being shared across the country, and how that data is feeding into the larger ecosystem of discourse in South Sudan.
Oh,
But like, but like there's so many other initiatives who are working on that.
okay. So viewers, like some of our guests have told me that they have gone to break the fast because it's Ramadan. So once they are done with breaking the fast, they are going to join us. So Nelson, you've said that you are engaged in matters information technology, isn't it?
Yeah.
Okay. So could you kindly share like technology initiatives that have been initiated at this particular point? Because here in Kenya, there are some youth who have started, who have developed an app that can track the COVID-19 cases here in Kenya. So I wanted to know, like, with regard to technology, what have now your peers or even your colleagues in the IT sector initiated?
Yeah, so like as we're talking right now, there are several of them. I know there is a one that is notable. Is the Facebook COVID-19 Information Center. Basically, it's an initiative by Facebook. I think it's also in Kenya and in so many countries, but in South Sudan right now, everyone who has access to has a Facebook account and has access to Facebook app can see on top of the information, they can see something related to Facebook COVID-19 Information Center. And this information center curates and put information related to, so information that is coming from the Ministry of Health, from UNICEF, WHO, and all the entities that are doing health-related work in the country. So all that is provided on the Facebook app, and I mean, on a very conservative estimate, probably is being accessed by slightly more than 1 million people or so who have Facebook accounts in the country. That is one of the most notable things. I also know a group that called Impact Capital Initiative. They have conceptually they have brought an idea of a wristband, a smart wristband that can be used for self-quarantine. So it takes signals of your vitals, so from the heart rate to temperature to stuff like that, so that people who land in the country and they want to be self-quarantine can be able to use that to monitor themselves throughout the 14 days before they are released. In terms of I know the data portal that for the 211 check I talked about earlier on. So there is a data portal that for updating people on all the cases in the country and what is happening and stuff like that. So there are like several interventions. None have still attracted a large-scale adoption. It's still in the early stages, but they're very promising solutions. But they're very promising solutions that are currently being prototyped in the country. The challenge that people are having right now is you realize that the traditional means of raising awareness and reaching to people are not working as they ought to work. Like previously, people used to put billboards, go door to door, and do all kind of awareness that is done physically, or distribute T-shirts and what. You cannot utilize these. I was telling people, like, even if you put billboards, I mean, no one is outside. People are kind of indoors because of these restrictions. So that cannot also work. You cannot also go to people's houses. You cannot distribute things door to door. So that really limits the amount of things that can be done physically. So people have to resort to radio. TV is there, but it's not that big. But people have to resort to radio and social media. And these two combined with like a very light trend on technological adoption in the country, I think that has signified a shift in how people communicate and how information is being shared. Most notably, even the government themselves have now adopted digital media mostly to run their communications. I mean, the recent IGAD head of states meeting was done virtually, and our vice president was able to join the meeting virtually. And so many other government meetings are being conducted via online teleconferencing channels, which I think is a very good sign. I mean, it's sad that it took a pandemic for this to for people to adopt technology, but like it's good that it's happening.
Great. Yeah, even here in Kenya, they have also introduced the telemedicine. So you find that they can even converse now with doctors who are from various regions. Yeah, so that they can they can share more and even learn more how to curb the COVID-19 using technology. Yeah, so Alfred Sigo has just texted me. He has said that technology has let him down. Yeah, so anyway, that's terrible, but I know that he will join us in our next broadcast. So Mahamat, Nelson, and Mahamat has also texted saying that he's going for prayers. He'll be back in 30 minutes. So so we have
Yeah, I don't know if you'll find me by then, but like, yeah, but we can share the rest of the things here. What I can do also, I can drop links to some of the things that we're doing.
You can drop them even in the comment section so that the viewers.
Yeah, I can drop the links to the comment section so that people can see and are able to access the work. Okay, the live comment section. Yeah, is it the live comment?
Yeah, the one for the live comment. So like
I don't have I can't type. No.
So I think if you
but let me drop it in the private chat and you can copy it.
Okay, and then if it is possible, oh yeah, I saw that. So this is what is happening in South Sudan. Okay, I'm
Yes,
seeing you have shared the fact check.
Yeah.
Okay. Yeah. So I wanted you now to expound further on what the links are about, so that the viewer can at least understand. Like we can start first of all with the factcheck.org.
Yeah.
Wow, that is awesome. Wow.
Yeah. So so like when you look at the 211check.org, it's basically it's a platform that is being used to fact check information. So those with access to the website can be able to see to see and access various various types of information that is being shared online.
So viewer, before we commence further with the Nelson, kindly I have shared it. Oh, Nelson is joining us. Nelson, oh yeah, Nelson is sharing it. Awesome. Yeah. So this is now you can start again and share.
Yeah, so I shared the screen. So I mean, people who are on the live screen, they can
All
see
right.
this is called 211 check. So what we do there, we share a lot of information so when there is a misinformation that is circulating online, we try to look for the fact and share it on that website and also share it with the community so that people can understand what is happening. Like, for example, what you can see here, this is basically an image that was manipulated when Uganda had their curfew and kind of lockdown. So you can see here, Ugandan soldier was beating two women on the streets of Kampala, and that picture was taken, and the flag was replaced with the flag of South Sudanese soldier to imply that this is happening in Juba. And usually, such things people do it, I don't know, with malicious intent or some reasons, in order to make people scared.
Okay, so this is just pretty awesome. So before you scroll down, now this is an initiative of. Okay, kindly share with the viewer what Defy Hate Now is all about, so that now they can understand why even while you're explaining these features.
Am I on the Defy Hate Now website right now? On the
no, you are not on the Defy website.
Okay, so let me just share the Defy Head Now website. So when you look at the work that Defy Head Now is doing, so Defy Head Now focuses on this is the website for Defy Head Now. So Defy Head Now, we are currently in 4 countries. So
wait. Go slowly.
Okay.
Go slowly. I have to maximize. Yeah. So, and then you can also state like your activities. Are they in the entire Sudan or where exactly? So go slowly for the viewer, because for them to understand. So start with the Defy Now, when it started and what's your role. Yeah. Continue now.
Yeah, so Defy Head Now was started in 2014, in part due to the conflict and sharing of hate speech in South Sudan. And it was started by an organization called Rogue Agency for Critical Culture and Transformation. And this initiative started in South Sudan basically to mitigate hate speech that was being led as a result of the conflict that is happening on the ground. So over the last 4 years, we have been able to do We have been able to train over 500 journalists, youth, and activists in the country on various methods of hate speech mitigation and awareness and stuff like that. And we've initiated several campaigns that have reached thousands of people in matters to do with hate speech and how to understand coexistence and the rest. Since then, our team has grown. We're currently in 4 countries. We have a team in South Sudan with a strong presence in Juba, but we are also present in Cameroon. We have an active team that does hate speech mitigation in Cameroon, focusing on partly in Yaoundé, the capital, in Douala, but we are also in Buea and other regions of the English-speaking Cameroon. We also have a presence in Ethiopia, in a region called Benishangul Gumuz, doing conflict mitigation among the youth. And we have an active presence in Sudan, in Khartoum. So we are present in these 4 countries. My role personally, I do programs development and training. So I manage and I initiate and work with a team that manages programs in all these countries. And most of the time I work with the youth on the technology, hate speech mitigation, and work focusing on also on the work on the disinformation campaigns and the rest. Yeah, these are the countries that we're present in. We have a lot of active work in terms of the youth. So we have 3 youth fellowships that are active right now in these countries. We have a fellowship called Art for Peace. That's what you can see on the website here. And we have about 5 fellows right now in this program. Is it 5 or 6 fellows in this program who are working on the various peace initiatives in Cameroon. So these are some of them you can see on the website. We have another youth fellowship that is called Facts Matter, and that focuses on tackling misinformation and fact checking. And this is based in Cameroon right now, and these are some of the fellows that we work with. We have about 8 people on that fellowship right now. And then the last one focuses also on youth engagement, and this is in East Africa. I mean, you're a Kenyan. We have some Kenyans in this program. This one is called Connecting the Dots, and the idea is there to bring people from various professionals and connect them with actual work on the ground. So right now we have 5 fellows, 2 from, 1 from Kenya, 1 from Malawi, and 3 from South Sudan. And I can also kind of clearly say that, like, we have 3 women in this and 2 men. So there is also an aspect of gender representation in these projects. Yeah, so that's basically what we do. We try to work with grassroots, with governments, with activists and media personnel to enhance their ability to respond to conflict and also crisis, like in the case of COVID-19 right now.
Oh, great. So now that you have started, now can you also now go to the other link, the one on fact check, the one that you had sent earlier, so that now the viewer can also see your other initiative. And then after that, we are going now we are going to go now to the Voices of Sudan. So let's go now to the check, the 2-on-1 check, and who initiated it.
Yeah, so the 2-on-1 check is the one that we're looking at right now. It was initiated by DeFi Head now. I can say, like, largely myself and also our team, our digital communication team. So the idea there is to fact-checking information and verification, fact-checking and information verification in South Sudan. So, like, we want to, because we realize that there is a lot of misinformation and there is a lot of spread of inaccurate information that might mislead the public and make people susceptible to incitement to violence and to other vices that also exist in the country. As such, we started this initiative. So currently we're doing fact-checking of information in South Sudan through our community of fact checkers and also network influencers. So you can see here we share a lot of information. The ones in green shows that this is an accurate information, and then also there is a lot of information that is in red that shows that the content that is being shared online is not accurate and does not and might mislead the public. Some global, like for example, this is a picture of President Putin that was manipulated to show that he's in a meeting with wearing a full protective gear, which was not the truth. So we go online and we find the actual picture, and then we educate the viewer or the online user by saying that this is not original, but this is original, and because of 1, 2, 3, and we kind of do that. We also have an active data portal that shows you statistics about what is happening in South Sudan and what is happening globally. So like what you're seeing right now on the screen, this is a tally, an active data portal that shows you the number of cases in the country. So as you go from the different pages, you see the number of cases and how the cases have increased to the current number, which is reflected there. So if everyone wants to get what is happening, and also you can see what is happening in Africa, that was for South Sudan, but also you can see the whole of Africa, what is happening here, how many cases in Africa. You can go to the different countries, Sudan, Cameroon, and all the rest. So you can actually see from each and every country what is happening there right now, how many cases, how many recoveries.
Wow. So like now,
yeah.
what you are now, so the red dots are showing now the COVID-19 situation in the various countries in Africa.
Yeah, yes. As you can see,
Wow.
like right now, I highlight here, like when I highlight on Kenya,
Okay,
you can
okay, go to
clearly see how
Kenya.
many. Let me just do that. So if
Is
I
it
highlight
possible for
in
you
Kenya,
maybe to zoom so that we can see the numbers clearly?
yeah, let me zoom in. So if I zoom in, I don't want to zoom too much.
Or even that Central Africa Republic is okay. You can
Yeah,
just go to any country.
Yeah, so when you highlight on a country, you can see the number of cases in that country
Wow.
clearly. So I come here, Uganda, you can see the number of cases in Uganda, the total 79, and how many recoveries they have. And that also applies to all the country. But also if someone doesn't want to view from that side, they can also come to a better view of it. You can see globally how many cases. You can scroll down and see like the increase of the cases throughout the different places, and that is how it works. But also you can search for the country. So that is one of the features that we added. So you can go to the specific country, and like for example, this is Kenya.
Yeah, Kenya is at 384.
Yeah. So when it comes to Kenya, we will be able to see, and also you'll be able to see how the evolution of the curve, is it reducing or not yet? So that's one of the things we do. We try to provide this data for people openly and accessibly to everyone who wants to understand it, and it applies globally to every country in the world. You can have a comparative things and see over time what are the recoveries, what are the things like that.
Wow, that is just pretty awesome. Viewer, you can even you can see for yourself what is the initiative now that the CSO Defy Hate now has initiated, and you can see the various products that they have, the services that they had. So he shared first about now Defy Hate now, what they are doing now. This is the fact check that they started, so that they can check now the COVID-19 statistics for each country. And right now, he's taking also us to also another link where he's going to talk about now the Voices Sudan now. So tell us more about Voices Sudan before we go to
So the last thing that I'm going to share, I'm going to talk about the voice post.
Yes.
So this is something that was started by one of our affiliate members whom work with us through our network. And in this, what we realize is that like the information sharing in the country, not everyone is on digital. There are a lot of people who are offline and do not have access to Okay, sorry. Sorry, I think I'm not sharing the right link. Let me just give you the right link. Sorry.
All right, it's okay.
So I'm just sharing the right link. So
Wow, I just love what I'm hearing from South Sudan. Sigo, are you seeing what I'm seeing? Sigo, especially what is coming out of South Sudan.
so okay, this is the right link. Let me just share with you so that you can see from the viewer. So ignore the previous link. So there is a link here called Voice Post 2019. So I'll just also highlight I'll just share the screen right now. So with Voice Post, it's a group that realized that not everyone is online. So there are a lot of people who are offline, but also they need to access information. So they created a network that uses that uses bicycles. These bicycles are mounted with, as you can see, these are the bicycles. So what they do is it's called Blue Bike. So the bicycles in it, they spread information about COVID-19 awareness, and they cover between 15 to 20 kilometers per bicycle every day. So you can see this bicycle here in front. It has a speaker that is mounted on it. And then on the back, there is a battery that is powering the speaker, battery and a sound equipment. So these young people actually go throughout the community, sensitizing the community. All the bicycles are blue. They call themselves blue bicycles. So they go around the community and move. This is the bicycle. So they move even to the villages. And the information there has everything about how to avoid COVID-19, washing your hands, doing what, like all this kind of things, social distancing. So these are areas that even radio and social media might not reach. So they cover this area, and they are very effective. So like right now, there are about 25 bicycles that are doing this, but we also hope to increase the number gradually.
Oh, okay. Wow. Hey, I'm just amazed by what is coming out of Sudan. So, are you done? Oh, and
Yes.
who are those? Who are they?
Yeah, so these are the young people. His name is Emmanuel. So these are the youth activists who are leading this. His name is Emmanuel. He's here. His name is Emmanuel Lobijo. So he's the one who is leading this. And and this person here, this is the undersecretary for the Ministry of Health. He's actually testing one of the bicycles. I think undersecretary, I don't know what do you call him in Kenya. It's the PS or something of that sort. Yeah.
Oh, wow.
I think that is it for now. I'll need to hop into other things, so so I don't want to take all your time. Also,
Okay.
I'd like to allow Sigo to.
Yeah. So I wanted Sigo now to also share so that you can also listen in to what he's doing. So Sigo, kindly introduce yourself and what you are doing here in Kenya. That is just even you can see let me call him. Hey, Sigo, go ahead and speak because you can't hear you. Yeah, go ahead and speak. Yes. So I think it's network connection, but he's coming through in a while. So let's wait for him.
Yeah. I don't know why he's not on. I can see him there.
Yeah, I also think with the guest from West Africa, I think Adam Conte. Oh yeah, Adam has also responded. He's saying that there is a problem on his side. I think it's network. Okay. He's trying to join, so I'm helping him out. So Alfred, could you kindly share with us about Pwani Youth Network and what you are doing to curb COVID-19? Oh, he's disappeared. Oh my God. This internet. So like Nelson, by the way, you are doing an awesome work. You are doing an awesome work. Okay. I'm trying to help Adam Conta from Mali. He's trying to join in. So give me like a minute so that because it's going to join in after a minute. Let me send it. Use the instructions we shared on. Yeah. So so yeah, we can hear you now. Go ahead. But we can't see you have. Yes, go ahead. Can you hear us, Sigo?
Okay. Okay, thank you so much. So my name is Alfred Sigo. I work for. Okay, I'll just use the audio. I think it's better.
Yeah. Go with the audio.
So my name is Alfred Sigo. I work for a grassroots organization called Pwani Youth Network. We work along the coast counties in Mombasa, Kilifi.
Can you hear me?
Yes, I can hear you, and I hope you can also hear me.
Yeah, go ahead. Go ahead, Sigo.
Okay.
Sigo, can you hear? Sigo.
So my name is Alfred. You can hear me now?
Yes. So viewer, kindly bear with us. Network issues. Yeah, but Sigo is coming. It's coming on.
My name is Alfred Sigo. I work for Pwani Youth Network in the 3 coastal counties in Mombasa. And most of our work is geared towards reproductive health. But due to the
Wow, 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 wow. All right. So, Dennis. So Nelson, maybe what you can do is, yeah. All right. Yeah. So viewer, there has been some technicalities with regard to network and also the region, but Adam is trying to join in. Adam Conta from Adam from Mali. All right. So Nelson has already shared, and we've seen the awesome initiatives that they're having in South Sudan. Okay. And so what you're going to do is just give us like 2 minutes so that I can get in touch with Adam, so as to see how we can help him out. All right. Yeah. So with regard to Sigo, you have also seen for yourself that there is poor connection, network connection from his side, because you can't hear him clearly. So Nelson is trying to get in touch. So, my God. Now this is what happens when you go live. You know, some things you've not planned for, and they end up happening. But yeah, so Adam. So if Adam doesn't join us, then we'll have to, yeah, let me call him right now so that I may know. Let me call him on WhatsApp so that we can know what's the problem, and if it's not going through, we can maybe hold I will hold the interview later on. Oh, Alfred.
Yes.
Oh, okay. You've gone to another room. Okay.
Okay, thank you. Now you can hear me.
Yes, very clearly.
Okay, I'm using my phone.
Okay.
So my name is Alfred Sigo. I work for Pwani Youth Network, a grassroots network of young people working across the 3 coastal counties, Mombasa, Kilifi, and Kwale. Most of our work are always geared towards working with young people in the creative industry, and we are also working mostly on reproductive health and rights of young people. So, since the beginning of COVID-19, what have we been up to? One of the things we've tried to do is to create awareness in communities, mostly the informal settlements like Bangladesh, Ghana, and also different companies that are actually having very many employees. So in those communities, what are we doing? One, we are actually doing mask distribution to these communities, and specifically working closely with the Department of Health in the county government of Mombasa and Kilifi to distribute masks. Then we are also doing community education on proper use and also disposal of masks, because again, we've realized that most of these communities are not actually using the mask the right way. The other thing is we've actually been through our some of our peer educators who have turned into community health volunteers within the health sector, are actually helping the county in a quick response in case there is an emergency or something is in need, or somebody is in need, or a community is in need of education and also sensitization. We've also worked with the county government in mass food distribution, and some of our volunteers have actually joined the county government in helping support distribution of food in those communities. We've also been able to run a couple of online campaigns just to help in sensitizing young people on issues of social distancing and also hand washing. And I marked a couple of health facilities that we do demonstration on proper hand washing, and also in different communities we've set up hand washing points so that people can actually sanitize and wash their hands often. Thank you very much, Violet.
And so oh, there's an echo. I think your phone is also on. Not your phone, but your laptop as well. There's an echo.
Yes. There's an echo. Okay, let me just put it on.
As he works on his phone, neighbor Collins is joining us from Nigeria. So neighbor, we can't see you. How are you?
Hello.
Hi, neighbor.
Hello.
Hi, neighbor.
Hello.
We can hear you.
Hello.
Hi, neighbor. We can hear you. Oh, yes. Awesome. You can now see you perfectly. So, Nebo, kindly share what you're doing in Nigeria.
Hello.
Kindly share what you're doing in Nigeria to curb COVID-19. Can you hear me, Nebo? Okay, let me text you.
The network here is hanging.
Oh, all right. Is it possible for you to refresh the net? Okay.
Yes,
the network here is hanging.
Okay, kindly refresh the net, and then now.
I just wanted to give an overview of what is happening in Mombasa currently.
Okay. Okay.
Through an intervention of the county government, we've seen that a couple of health facilities have been upgraded specifically to get ready in case the numbers keep on increasing the way we are seeing. And today, out of the 10 new COVID-19 cases, 9 were in Mombasa, and 1 was from my specific area where I stay. So one of the precautions we are intending to do is to push for the issue of people staying at home, the issue of social distancing, so that we don't get more new infections within these communities that we live in. We are also currently mobilizing for more food and other essential items for communities, specifically the informal settlements that we work in. And in the next 1 week, we are embarking on actually putting up murals and also graffiti on different walls as education materials for different communities. Yeah, thank you.
Wow. Thanks, Sigo. I've been seeing the remarkable work you're doing with the county government of Mombasa, led by Governor Joho. Awesome work.
001.
Yes, 00. I've also seen that the can you kindly talk about the CSOs, what the CSOs are doing together? Because
Yes.
I've seen like the CSOs in Mombasa, they are doing remarkable job as a team. Kindly share more about that.
Yes, currently the CSOs have come up with a working group, and we are actually supporting the county government in one, verifying the names of communities or families that should benefit from the food rationing program. We've also earmarked and actually following up with the health facilities on their preparedness. And we are also compiling reports that are specifically looking at which areas needs mitigations, what are the hotspots, and what can the county government actually invest more into so that we reduce the number of new infections. The CSOs have also have a rapid team that is actually responsible in case there is any case or any alert. The CSOs are always the foot soldiers, supporting at the Kenya Ferry, supporting in those hotspot areas that have been identified, like the Likoni Ferry crossing, Nyali Bridge, and also Kongowea. We also know that the CSOs have actually done a memorandum to the county government to ensure that those who are actually on quarantine, the county government foot for the bills. Because again, it is another challenge to get someone who is infected and cannot pay for the services in the health facility. So together with all the CSOs, we've lobbied the county government. And yesterday, the county government announced that they'll actually foot for all the bills that anybody will incur in any health facility or in any quarantine facility across Mombasa County.
Wow. I'm just amazed by the remarkable work you are doing in Mombasa County. So let me try bringing in again Nebo from Nigeria. Nebo, can you hear us? Let me unmute his mic. All right. Nebo, can you hear us? Let me text him. So as Nebo is trying to get back online, I've told him to. Oh, here. Oh, Nebo, is your mic connected? Yes. Awesome. Nebo, have you heard what?
Hear me?
Yes, we can hear you. Go ahead.
Yeah, can you hear me?
Yes, we can hear you.
Yes.
Introduce yourself and what you do in Nigeria.
I'm connected.
Yes,
A little difficulty in Nigeria. Network is not too strong, but I can see you and I can see Alfred.
Yes.
Hi. Okay, kindly
yes,
share
we
what
can hear you. Kindly proceed.
Yeah, proceed. Yeah, so there seems like there's a communication problem, but I'll talk to him via messenger. So Alfred, you know, people are saying that
Yes.
what Governor Joho is doing can even enable him even earn an award. All right. Kindly share what the county government of Mombasa has initiated with regard now to curbing COVID-19, and especially with regard to the ferry as well?
Thank you so much again. So one of the things the county government has done is actually to set up a specific ward for COVID-19 patient at the Coast Referral Hospital. That is actually the major hospital serving all the coast counties. Number two, the other day he opened up another COVID-19 quarantine center that we can also act as a ward or a hospital at the Mombasa Polytechnic, the former Mombasa Polytechnic. It's a 300 bed capacity facility that will actually be added into the other existing facilities. The county government have also actually pushed for social distancing at the Kenya ferry, and for the past 1 month or so, we've seen that the congestion that was being witnessed in the ferry for a while has actually reduced, and the county has also been distributing face masks to everyone that is passing at the ferry. The county government have also set up a couple of things like sanitizing booth at the Kenya ferry, sanitizing booth at the Nyali Bridge, and also as another sanitizing booth at the biggest market in Mombasa, the Kongoya market. Those are just a couple of things that the county government has done. We also know that the county has also been fumigating most areas that they term as hotspot in Mombasa to ensure that they curb the spread of COVID-19. Thank you.
Wow. Remarkable. Nebo, let's see whether Nebo can Nebo, can you hear us now? Nebo? Nebo? Yeah, so there's a network issue where Nebo is. Adam from Mali is trying to connect. He was trying to use I've told him what to do to rectify the issue that he's having with regard to connection. Yeah, Nebo. Yeah, I've muted. So, viewer, you've heard for yourself what is happening what is happening in South Sudan. Oh my God, remarkable work, remarkable, great. I just can't. That's the reason why I love what I'm doing, because using this platform, I get to understand what other countries are doing, and to see how South Sudan have penetrated even the tech space and even what they are doing right now, so that they can fact check what each country in Africa is faring with regards to COVID-19. That's just remarkable. I'm just amazed, and even the use of bicycles now to even spread the message. I'm also glad to also learn even about what Alfred Sigo has shared about Kenya. Yeah, I'm from Nairobi. I'm from Nairobi County. He's from Mombasa County, and they have been having an awesome initiative there, working closely with the county government. You've heard for yourself what is happening. Yeah. Okay, we can hear the traffic with Nebo, but not his voice. Oh, yes, I was just reading a comment from a viewer, because they are saying that they can hear the traffic, but they can't hear his voice. So that is Nebo. So Nebo is yeah. So let me tell him to try again. Try again. Yeah, we can hear traffic. not your voice. Not your voice. So Adam is telling me, Adam Conte from Mali. He's telling me, Violet, kindly don't leave. I'm trying to connect. I just love the zeal, you know, like, when, like, you see, that is why I love what I'm doing. Because I know, like, Paul Shaw, who's also watching, he's from Scotland, he's telling me, Violet, I'm amazed at your patience. All right. But, with life, you have to be open-minded. Sometimes things can happen that you do not expect. Like today, the viewers, some of them, they're going to break the fast. Others, the network has an issue where they are. All right. And then you're seeing them texting you, telling, oh, Violet, you're trying so hard to like Sigo was telling me, oh, Violet, there's no network. He had even to go to his bedroom so that everything can work out, and it finally did. So I'm reaching out to Nebel again because I really want to know what is really happening in Nigeria. And yeah, so the mic, yeah, so okay, yeah, so he's joining in. Adam is telling me, please wait. All right, let me ask him, are you ready? All right. Yeah, so yeah, so they are trying on their end to solve this issue. So in the meantime, as they join, let me share a brief about myself, because it's not like I started from where I am at the moment. So maybe I can share a brief history about my development, my development work. So my rural home is in Machakos, and for years I've been going to my rural home, and I'm seeing the trouble people have with fetching water, because people had to travel for long distances with donkeys so as to fetch the water. And then I also saw what deforestation is having on now with regard now to the different communities, and how now the cooking now with the three-legged stove, the effect it has on people, because like in our area, it was leading to now high respiratory illnesses. All right. So I said, okay, let me just start with the two initiatives. So in 2013, I started with the Improved Cookstoves project, where I got in touch with GIZ, Energy Development Program here in Kenya. And I shared with them the problem that is troubling my people back home in Wamunyu. Yes, yeah, that's now my rural home. And then now after that, now I also approached a certain CBO, and I asked them, like, what resources do you have? They told me, well, we have a 1/4 acre of land somewhere, and it is laying idle. I asked them, where is it exactly? So they told me, oh, it's just near a riverbed. So I told them, is it okay with you if, because when I look, with what you've told me that you have enough resources in the bank, and you have already a 1/4 acre of land, and it's near a riverbed. I told them, what should I thought of maybe starting a yeah. So I told them, is it okay with you if I initiate a dam here? They told me, oh, Violet, even there was a dam here that was in the 1960s, but in time it just it collapsed, something like that. I can't remember the words that they used. They just said it collapsed. So after that, now I told them, if I get your blessings, I can approach the county government of Machakos so that we can see to it that there's a dam is constructed over here. So they gave me their blessings, and I approached the county government. I wrote a proposal. I even wrote it within 2 hours. I was done, and I submitted it. And that is how I started my initiative. And those initiatives have enabled me to travel abroad.
Hello.
locally and regionally and also globally. Yes, I'll continue later. I'm seeing Nebo is on. Nebo. Yes, we can hear you.
I can't hear you properly.
Okay, can you hear me now? I can even see you.
I can't hear you.
Can you hear me now?
Hello?
Okay.
Hello?
Hello. How come you can't hear me? Just go to the private chat. Just go ahead and talk. Okay. Go ahead. Okay, let me just testing. All right. So I've reached out to Nebo. Yeah, so Nebo is going to start sharing about what he's been able to do. Yeah, so like so he's working on his internet, so it's going to be back. So this life teaches you a lot of lessons. So Paul, sure I know you're watching me. You're telling me, oh, Violet, you're so patient. Yes, Paul, I've gone through a lot, and as a leader, you just have to be patient because sometimes things may not work as you plan for them to work. All right. So when now I started the initiative, the water project, now there's a German organization called Friedrich Ebert Stiftung. They heard about my initiative and they said, oh, Violet, why don't you so they said, okay, they're looking for young people who can join now the Friedrich Ebert Stiftung, okay, political leadership and governance program. So I applied and I was taken and we went through a 6-month training. And as a result, the knowledge that I attained there, I was able to implement. And now I started even traveling now to different African countries. I traveled to the African Union Commission Heads of State meeting that was in Ethiopia. And I was even invited as a panelist, though when I reached there, things changed. I didn't present. But anyway, I'm just happy that they were just amazed with the work that I'm doing. So I'm seeing Nebo. Nebo, can you hear us clearly now?
Hello?
Hi, go ahead. I think there's an issue.
Okay, thank you very much. My name is Nebo Collins. I'm the executive director of New Century Initiative. Yeah.
So you have stated that you're the executive director at New Century Initiative in Nigeria. So kindly tell us more about what your organization is doing to curb COVID-19 in Nigeria, and which part of Nigeria are you based?
Okay, I am based in the southeastern Nigeria. Currently, we have issues of hunger because of the lockdown. There was no preparations, good preparations by government to be able to sustain the people at home periods. So we find it difficult to keep people at home. So what we do at New Century Initiative is that we go into communities, we sensitize the people of the need of staying at home, and we use not just because we also respect the fact that government said that we should stay at home. So we use the media stations, we use social media platforms to share information about this on different networks we belong to, on WhatsApp and also Facebook and Twitter. So what we try to do is that we also mobilize people that are living in the rural communities. We talk with them on the phone to be able to know the situation in their locations. So, however, in our own little way, in order to motivate this action and also make the people believe in our own message, we were able to share some palliatives. We, as much as little as we can afford, we shared some, rice and some other foodstuffs we gave out to people, encouraging them to stay at home, also encouraging them to go into farming and other sources. But however, the government has also initiated a soft, what they call soft lockdown, that people, traders that sell drugs or medicines and foodstuffs can come to the market and sell. So, but however, we were able to also inform people that if they see any case, or they notice any case, or they suspect any case in their communities, especially in the rural communities, they should call the government toll-free number to report the case, so that they should not get close to the person, so that the government can come and pick the person up. So we encourage them to keep clean, wash their hands regularly, especially though we're having problems with areas that doesn't have potable water. We're encouraging them to try as much as they can to wash their hands often, not to touch their faces, and to also use hand sanitizer, or probably if they have access to alcohol, they should also apply alcohol in the rural community, but they should not get close to the fire, because alcohol is not good for fire. So what we're trying to do is to simplify these methods, so that people in the villages and rural communities can be able to see it as an easy task, so do for themselves, and not to see it as a rocket science. So that is it. We don't know how long the lockdown will last, and we don't know how long the situation will last. But we hope and we remain very optimistic as organization to continue to do with our work with our media partners, and also discuss varying issues, bringing the knowledge of the state administration, government administration, to the needs of Nigerians. So that is the little we can do so far. And we also hope to collaborate with, if we can get more support, we can collaborate with as much as community-based organizations as we can, to be able to effectively reach out to communities where we cannot access, maybe because they don't have access to radio stations, and probably they don't have access to telephone facilities. So that is what we, and we are also encouraging the international community to do as much as we can, donor agencies, to also keep up the good work they are doing, and working with some of us at the regional and national and local levels and the communities, to be able to help our people, because this is a serious epidemic, the one the people here are not used to. I am very sure that if we do as much as we can, we are going to solve this problem. Yes.
Okay. So Nebo, I wanted to ask you, like, what's the current situation in Nigeria with regard to statistics? How many people are infected? How many people have died? And how many people have recovered? If you have, maybe you can just tell us briefly.
Sorry. Sorry, I can't hear you properly. I don't know what happened. I can't hear you properly.
Okay, maybe I can repeat again. Can you hear me?
Hear you properly. I don't know the network issue we are facing here. Actually, is quite challenging. I can't really hear you properly. So sorry about that. I know you are talking to, but I'm very sorry that I don't know what's happened. I can't hear you.
Okay. I'm texting you. I'm texting you on Messenger. So just check the Messenger. So viewer, as he joins us in a few, let me reach out to him. Just be patient. Where is Nebo? Share country statistics. Yeah. So as he refreshes his internet, all right. So I had started sharing with you. So I was invited to the youth dialogue during the heads of state and government summit in Ethiopia. That was in 2016, and I was invited so that I can go and share more about what we are doing, and I'm glad that I did. And I started improving myself. I started reading widely. I started incorporating best practices, and slowly now people got to know about my work and how it's impacting people. The county government of Machakos even released funds for the construction of the dam. And like even right now, like even I was elected by the working group at YAN as to chair the working group on women empowerment, women representation the group is, I chair the working group on political feminism, women representation in African democracy, and women empowerment. And I'm glad I took up the role because I'm representing various youths from across the continent. And you can see, like right now, it's like, what I can tell people is, if you want to start something, just start. The rest is going to follow. Don't procrastinate. Just go step by step. You see, like even this particular show, how it started. There's a friend of mine. She's from Italy. So she had posted on Facebook that she's undergoing a panic attack. So I reached out to her on WhatsApp. I called her. She's in Italy and lockdown since February. So it's like they're just confined in their room. So when I talked to her, she told me, "Oh, Violet, I'm usually here. There's no one I'm talking to, and I need some, and it's like you're just seeing negative stories all through." So what I told her, then there is need maybe for people to start sharing their stories on Facebook, on even different platforms. So we started off with Facebook, where now we brought youth from diaspora, those ones who are studying in Europe and those ones who are studying in Kenya, and those ones who are, and also those ones who are studying in Africa, US, even those ones who are working. So now they were able to connect, they were able to chat. And now I got to realize that there are various facets of the COVID-19 pandemic that are not being discussed. So we decided that we'll start discussing various topics with different players from the African continent and the impactful work that they are doing. And that is how now the real talk show, hosted by yours truly, started. And I'm just so excited. I'm just so excited learning about the remarkable initiatives that are taking place all over Africa. And Nebo has shared some statistics from Nigeria, so I want to upload it Okay. So, oh, Nebo. Yeah. Yeah, Nebo. Yeah, Nebo. Hi, Nebo.
Hello.
Yes, yes. Go ahead.
Okay. The total we have records. We have 1,535 cases so far. Cases so far, and we recorded 2,250 recoveries, and we have 4 deaths so far in Nigeria. Yeah.
Oh, you had like yeah, I can see that he has shared an image. I'm trying to see how I can upload this image. Let me try.
Okay, so that okay.
Yeah, so viewer, let me try to
Okay,
upload.
that's the recent case because the
Okay. All right. Yeah. And like have okay, wait. So Nebo, have CSOs come together in Lagos to work together to curb the COVID-19? Have they formed a network, or is there a network that is operating at the moment?
yes, we have a network on that at different levels. Presently,
I can't hear you. You had muted your line.
yeah, I tried to test the microphone. I'm testing the microphone.
Okay. Continue.
So, can you hear me
Yes.
now?
Yes. I can hear you.
We have okay. So we have CSOs at different levels. In my state, we have a network of CSOs working to also support government actions and also advise government on what to do step by step. A step by step action the government is taking to also see the ways we can also communicate effectively be a bridge between the people and the government. So we also track the government support for the people, what government is giving out, what is the amount of support government giving in terms of food supply to the people. We're also doing research on we have done the research to identify the equipment.
Oh my neighbor, we can't hear. But viewer, hey, yeah. So viewer, I want to say thank you for being patient with us, and yeah, and for tuning in. I'm seeing some messages here. Yeah. Yeah, so Nebo, can you hear us? Can you hear us? Oh my God. So anyway, viewer, as I was telling you earlier, so when my friend Grace Mageka shared with me the difficulties like she's facing in Italy because of the lockdown, so I decided after discussing with her, we realized, oh, there's need even for a talk show. And she even asked me, oh, Violet, you can also use your background. So she was asking me, Violet, what do you do? I told them, oh, I also studied journalism at USIU. USIU is United States International University. So I told her, yeah, but I've just been using it not practically. I've been more into projects, initiating projects to completion. So she told me, oh, Violet, why don't you just use your communication skills, so that you can give hope to some of us who are locked down, and we can get some encouragement. And that is how now this initiative came along. And I'm so happy that people who have graced even this set are former presidential candidates. Like we have a former presidential candidate here in Kenya, awesome youths who are doing awesome work all over Africa and even abroad. And today, as you've heard, different countries are doing remarkable things. But also, because of also there is a Ramadan, our friend, I think he's still praying, and they're breaking the fast. So I think now I don't think he's going to be able to join us. So, but I'm so grateful that you've taken your time to join now this chat. And I'm grateful for the stories we've heard from Nigeria, the stories we've heard from Kenya, the stories, the initiatives we've heard also from South Sudan. So those are 3 countries. So the countries that have not been able to grace the set today was Uganda, which other country? Mali, and Chad. Chad is because, and Chad. And it is because of the reasons that I had stated earlier. So viewer, we have to come to the end of this particular show. All right. I'm seeing someone has texted again. Oh my. I am just seeing massive love from people. So I'm just excited about what I'm doing, and yeah. So viewer, it's good we've heard at least from 3 countries what they are doing, the CSOs, and how they are curbing this pandemic. So join us next time, even as we discuss even more topics, so that we can now get to learn more what is happening in the African continent and how we can grow it. And it's also remarkable to also hear from Madagascar that they have developed a hub that is that has worked in their country to heal some people from COVID-19. Though World Health Organization has said no, it's not the right, but it has also worked. So let us also celebrate our African scientists. At least they are trying to do something to curb this situation. So to the Congolese doctor who has now been recalled by the president of Congo to go back home and replicate the success there, it's just a massive congratulations to you. And us from at a Real Talk Show, hosted by yours truly, we are really proud of you, and thank you for your initiatives. In Africa, we are strong. Africa, we are brilliant. For a long time, we have been waiting for the West to bring solutions, but I'm happy to see that even African organizations themselves are also initiating things. They are bringing up to date, they're initiating even projects. And like even today, you've heard from the 3 countries, the remarkable work that they are doing. So that means that as Africa, there is hope. And I know that we are going to grow as one. I know as when we are united and when we all think as one, to ensure that Africa progresses, we are going to see more of this. I don't know why the story of what is happening in Madagascar is not on various international platforms. So I don't know whether it is because it has happened in Africa. And I think it is good time that even the West try now the herbal concoction, so that they can see whether they can test for themselves whether it is working. You know, in this world, you need to support each other. It's not good for you to always say that you are the one who's always right. It is good to, to give others even opportunity to just test and see. If it doesn't work, yes, it doesn't work. And we can agree it doesn't work. But I think it is time to also support each other in our different endeavors. And I know if we do that, we are going to grow even in Africa. So viewer, thank you for joining me, and I've learned a lot, and I hope you have also learned a lot. And yeah, so if you'd like to get in touch personally with now the guest, you can just get in touch with me and I will hook you up so that now you can now take the discussion to the next level. So thank you, and thank you for gracing this set, and yeah, enjoy your evening. All right, cheers. Yeah, now we are ending it. Thank you.